Welcome to Medicas Video Podcast once again. My name is Varun. I represent EGS Health, where Medicas as an online doctor consultation platform has been produced. In today's topic, we have a very important subject to discuss, which is kidney failure. We all know kidneys are one of the vital organs of our body, and we also know what kind of a impact a kidney failure can do to a family as well as to a person, not only physically but also financially. In order to discuss this important topic today, we have Dr. Karthic Kumar. He's got 13 years of experience in practicing medicine. He's a specialist in general medicine and also a nephrology and a renal specialist and also a diabetology. Dr. Karthik Kumar has the following qualifications: MBBS, Fellowship in Diabetes Mellitus, Edition 2, Certificate in Infection Control, Certificate course in Family Medicine, Fellowship course in Clinical Nephrology. So, without wasting any time, let's welcome Dr. Karthik and let's dive into this meeting today. Dr. Karthik,
Hi,
Dr.
good
Karthik,
morning.
thank you for accepting our invite and joining us today to discuss the
It's a
most
pleasure to
important
be
topic,
with
which
you.
is kidney failure. Namaste, sir. Yes. So, Dr. Karthik, I mean, there are a lot of illusions around this kidney failure. Some of them knows this in and out. Those who are already suffering, or maybe the family members that are already suffering with this kidney issues. Time and again, doctors like you, elders, grandparents, everyone consistently informs all the patients, or rather public, to drink a lot of water to ensure that you follow certain hygiene and certain routine to ensure that your kidneys are not affected. Yet we see a lot of these cases coming up. Of course, there are a lot of factors we understand for these kidneys to be failed. We want to ask you certain important questions to get more specific answers from you, Dr. Karthik. So
Sure.
what is a kidney failure? Can you please
Yeah.
start there?
Okay. Basically, kidneys are two bean-shaped structures that are present on either side of the spine. A healthy kidney will be around 10 into 3.5 or 4 centimeters. And kidneys, as we know, kidneys has a lot of functions, of which the main functions will be like excreting the excess of water, salt from the body, production of red blood cells, that is the hemoglobin, and excretion of unwanted waste products like urea, creatinine, and other things, and also maintenance of blood pressure. Kidney failure doesn't occur just by dehydration at all. 60% of the kidney failure occurs to people with uncontrolled diabetes and uncontrolled hypertension. So diabetes and hypertension forms the two major things in what to say in the line of formation of the kidney failure. So people who has diabetes and hypertension should always be concerned about major organs being affected. So their point of view should be like controlling their hypertension well, as well as controlling their diabetes to a point where the doctor gets satisfied. So kidney failure starts like this, and there are 5 stages of kidney failure. One by one, we will discuss as we go on.
Sorry, I was on mute. Right. So
Yeah.
we want to understand, Dr. Karthik, who are vulnerable to this kidney failure.
Okay. First, as I said, the first point of population will be people with diabetes uncontrolled, hypertension uncontrolled, people who are not drinking proper water, people who take a lot of alcohol, smoking, drugs, people who have recurrent stone formation, and the people who are prompt to doing certain things which are not accepted by the body. These are the certain things where people are vulnerable to become a kidney failure. And unfortunately, people who have a family with cystic disease, kidneys with cystic disease doesn't occur like that. If my father, my grandfather had a cystic disease, it passes on to the generation. So unfortunately, the world hasn't come up with a treatment for the cystic disease. So cystic disease, when it passes on, slowly it will enter into a stage of a kidney failure. So these are the general criteria for people with kidney failure.
Okay, Dr. Karthik. When it comes to these kidneys, we kind of hear this particular word a lot: kidney stones. What's the difference between kidney failure and kidney stones? Is there any relation between them?
Yeah, basically, kidney stones are nothing but a formation of calcium oxalate or uric acid. when the calcium or uric acid goes in excess in the body. These are the two basic common things that forms the stones. Rest of the things we'll discuss later. But calcium, which is rich in dairy products, and uric acid, which is rich in red meat and other things, when we consume a lot, they tend to deposit in our body as crystals. These crystals find a place for them to get hidden or get deposited. Kidney is one such place where these go and get deposited. So when the kidney stones develop, there are enormous number of stones present inside the kidney. For example, like deposition happens, like hundreds of stones can present inside a kidney. But having so much of stones inside a kidney will not cause the problem at all. But
Okay.
when the stone tends to come down the kidney through the ureter, there the problem arises. People will start getting the symptoms like vomiting, pain in the sides, blood in the urine, and a severe pain, no urine at all, and also kidney failure. This is a temporary phase. But as the kidney formation, stone formation recurs, and the size of the stone grows bigger and it obstructs the pathway, gradually the intervening surgeries and the medicines given to those to prevent them from the formation of stones will end up in kidney failure. And finally, the kidney failure due to stones will be like a permanent obstruction caused by a stone leading to kidney failure. Not that it is a myth like stone will cause kidney failure. No,
Okay.
stone will not cause kidney failure. But recurrent stones and intervening the stones and also the obstruction of the stones might lead to kidney failure.
Okay, okay. Thank you, doctor, for the clarification. See, when you go to a hospital, can you? There are two questions. Probably, will kidney failure happen all of a sudden? Like, when you go to the hospital and the doctor tells you, "Hey, your kidneys have failed." That is my first question. And the second question is, what actually is a kidney failure? When a doctor tells any patient, because we hear this from a lot of families also, doctors have told me my kidneys have failed. What is actually a kidney failure? I mean, what will
Okay.
happen to our body? I mean, you explained this, but what will
Yeah.
happen to our body when the kidneys fail?
Let's discuss in two parts. Okay. First thing, the importance of the master checkup comes. So that's why we urge people who are above 30 years to do at least once in 2 years to check their body fully, involving the blood and the urine, along with an ultrasound scan to make sure all the organs are perfectly working. When they cross 35 to 40, it is ideal for them to do yearly once master checkup. When they cross 40, 45, it is better that they do the scan and the blood test and the urine test once in 6 months. This is a basic idea that we suggest to the common public. Now, coming to what is called the kidney failure, how does it occur? See, kidney failure, first point, it doesn't occur all of a sudden. Public should know this. It is not like overnight we are sleeping and the next morning you get into a severe kidney failure and rushing to the hospital. No, the body will start getting the symptoms of kidney failure from a very early stage itself. It is
Okay,
we, the public, ignore those problems. For
okay,
example, a patient who is entering into a severe renal failure and rushing to the casualty, secondary to hypertension, when they check, he will be like breathing enormously and will be in a condition called pulmonary edema. The
okay,
family wouldn't have known that he has entered into a stage of a severe kidney failure, but we
okay,
will be telling them that he has been having this kidney failure for a long time. It will take
okay,
quite some time for them to accept this fact. But the problem is, he would have been having a high blood pressure for quite some time, and the patient would have been suffering headache for a long time. This headache was thought to be a common thing, and he ignored taking just the painkillers. He
okay,
never went to the hospital. He never went to a physician to check himself, and finally ended up in having a kidney failure, which has progressed to the irreversible stage. This
okay,
is one. Second thing, you asked me about kidney failure, whether it progresses. Yes, kidney failure progresses from stage 1 to stage 5. Now, let's keep a person who is entered into a mild renal failure, mild kidney failure. For example, if I'm coming to you, you are a doctor, I'm coming to you for a checkup, and you are checking my blood and urine and an ultrasound and telling me that the creatinine is mildly elevated. Creatinine is a marker to check the kidney functions. So the creatinine is elevated is compared with an ultrasound scan. The ultrasound scan of the abdomen tells me whether the kidney structures are okay along with the creatinine blood test. This is the way we correlate the kidney function. So you as a doctor tell me that my kidney function has been mildly deteriorated. From there on, I should start practicing the facts which will not affect my kidney. And every month or every particular day, whether in which day you ask me to see you, I should follow you. I have to
Okay.
control my blood pressure. I have to follow the steps you told me. I have to follow the diet and everything. Nowhere in the world the nephrologist will be able to prevent you from getting a chronic kidney disease. But
Okay.
postponing the requirement for a renal replacement therapy can be uh, done by a nephrologist. So this word is an important thing. Anywhere in the world, the nephrologist will not be able to reverse a chronic kidney disease. But
Okay.
chronic kidney disease progressing to a stage 5 can be postponed.
Control.
So
Okay. Okay.
this can be
Okay.
done by a doctor, and the
Great.
need for the renal replacement therapy can be modified.
Great, great. Thank you, Dr. Karthik. I think it's very important, for our public because that's the right statement you made. We keep neglecting, and we understood from you that kidney failures don't happen all of a sudden. They go stage by stage. Symptoms will be shown. You go to a right doctor, you follow certain medication, and you try to
Yeah.
actually reduce the progress from stage to stage. Majority of the times, as patients, we tend to neglect our health because of this busy
Yes.
world, right? And God forbidden, the kidney failure has happened. And now it is at a stage of, I believe, we have been hearing about this word, which is kidney transplantation also. Now, if a kidney transplantation, there are two ways to do it, either with your blood relation or with your other person, which is non blood relation. What is the waiting period if you have a blood relation? How long will it take for the kidney transplantation to complete? Will it be successful or not? Number two, if you don't have a blood relation, if you have to wait for that organ replacement, how long will you have to wait? Will that be successful or not? Can you please,
Okay.
answer these questions, doctor?
Okay. So kidney transplant is a wonderful option that has evolved in the last few years. And the people who are entering into a chronic kidney disease, entering into a stage of 4. 4 is the stage where we will sit and discuss with the family about the long-term plans and the future plans.
Okay.
Stage 5 is the place where they require dialysis. So, stage 4, we will be thinking about creating an access for dialysis. Like we have vascular accesses like temporary catheters, permanent catheters, fistulas. These are the ways through which dialysis can be carried out. And the second option is like going for a transplant electively without going into the stage of dialysis. Now, people, two criteria. We'll see the recipient, we'll see the donors. The recipient has to be less than 65 years of age and perfectly fit with all the cardiac and anesthetic fitness being got, and they should be ready to accept the organ in their body without any complication being happening. Okay, this is the stage for the transplant recipients. Now, going for the donor has to be diabetic free. He shouldn't have a diabetes, and
Oh,
he or she has to be less than 65 years of age for him to donate, for him or her to donate the kidney. Now, kidney failure, uh, when it happened, they should sit with the family and discuss whether they are going to get it from the family member or from a deceased member. See, kidney cannot be got from a friend. A friend can be like 30 years close friend, and if he is willing to donate kidney, it is not accepted.
okay.
2007 or 8, the government passed a rule in India that kidneys donors should be only family based,
Okay.
or the kidneys can be got through the deceased donors. So now coming to the live donors are the family members. The blood group can be any group. We are doing same group transplant or across the group transplant. Across the group transplant is a bit more complicated as it requires so much of intervening processes like plasmapheresis, suppressing the immunity to a lower level than it is
Mhm.
required for same group transplant.
Okay.
Success we cannot predict, but at the same time, hospitals, very good transplant hospitals, hold a record of having 97, 98% of transplant
Wow.
successes with same group transplants and above 90% success rates for across the group transplants. So it
Wow.
is very important for them to choose a very good hospital with an experienced nephrologist to go for a transplant rather than thinking about a cheap place where they do it with some complications and end up in a misery.
Absolutely, doctor, because we have been hearing about a lot of rackets in news channels with respect to these kidney transplantations and kidney rackets as well. A lot of innocent public fall prey in that, urge of ensuring that the patient is, not affected. And they actually fall prey to this disguised people in the, in the name of doctors, in the name of hospitals and also. This, I think, is a call to all the public. Ladies and gentlemen, please ensure that you go to a qualified doctor, you go to a qualified physician, and ensure that you do thorough analysis and also get case studies from that doctor and also from that hospital before you even spend a single rupee and take your person to the particular hospital for the treatment. So, Dr. Karthik, I have some more important questions to discuss about this. So let's say if there is no blood relation and they are unable to actually find someone that they know for the kidney transplantation. And obviously, I believe, I'm not sure, but I want to hear it from you for the first time. Is there a way they can enroll this patient for an organ transplant, somewhere online? And that's my first question. If they enroll, how long or an average will it take for them to receive a call from that organization that the kidney is available and you can be prepared for
Yeah.
the transplantation?
Okay. Every hospital will be having a organ donating committee.
Okay.
Either the HR or the PRO will be having a contact with them, and the organ donation committee can be contacted through them. First thing, if there is no live donor relationship person to donate kidney, they have to approach them and tell them that they don't have a live donor to give a kidney for transplant. At that time, the person who is responsible for this will introduce them to the organ donation committee, where they will be enrolled and they will be given a ranking list. For example, the ranking list, like rank will be like 5, 6, 10, or something will be there. Your blood group, everything will be noted down, and at least it will take 1 to 3 years time for them to get the kidney appropriately. So the waiting period is more. On that time, during that time, they have to undergo dialysis on a regular basis as committed by the nephrologist. If they skip dialysis, complications of dialysis, kidney failure will occur and they will risk their life as well.
Wow. I mean, that's a very long waiting period, doctor. 1 to 3 years is like, very long waiting period. And I'm sure that they have to go through a continuous dialysis during that time. What is an average cost of a dialysis to be done? I know there are government organizations that are offering, I mean, of course, government hospitals are offering it for the free of cost, but there are vast majority of people would like to go for a private hospital. What is an average cost of a dialysis for patients who failed
Dialysis
their kidneys?
usually involves uh, you being connected to a machine.
Okay.
The machine draws a lot of water from an outline pump, and also the water gets converted. And then there are two pumps, like an axis will be put in new, and the machine also will have two pumps in it. One will be a blue line, one will be a red line. So
Okay.
blood will be taken through one line, it will be sent into the machine, and the machine will purify the blood, and the purified blood will be returned back to your body. This is the
Okay.
mechanism that happens in dialysis. Like our
Okay.
kidney does this 24 hours a day. The dialysis will be done only for 3 or 4 hours a day. That also in once in 2 days or 3 days, depending on the nephrologist's request. So
Okay.
this involves a lot of processes and the dialyzers, the reagents, everything. So a
Okay.
good dialysis will occur anywhere between 1,800 to 2,500 rupees per session.
Okay.
Even dialysis is carried out for 500 or 700 rupees. But unfortunately, the clearance of the urea, creatinine, the healthy well-being of an individual after finishing a dialysis is not attained at that level of being dialyzed.
Right, right, doctor. I mean, when you're saying 1800 to 2500, though the number sounds smaller compared to, when we talk about a 5 digit or a 6 digit numbers, but getting it done on a daily basis, which means every fortnight, will definitely turn out to be an expensive activity for a middle class family. So, according to, I mean, you just explained how dialysis, machine
Okay.
works. how
Now,
dialysis? Yeah, please go ahead, doctor.
okay. Basically, when a patient enters into a stage where he is declared to undergo dialysis, dialysis is not something that is done on a daily basis.
Okay.
Initially, it will be initiated, explained to the patient about comforting him and making him comfortable to introduce to the machine. He shouldn't be
Okay.
scared on seeing the machines and the connections and other things. Already, he
Correct.
will be depressed state in knowing that his kidney has been failed. So, we should
Correct.
be a counselor as well as a doctor as well as a family member to the whole family.
Right,
Dialysis
doctor.
should be done between 9 to 12 hours per week. This is the
Okay.
general healthy session that has to be done for any individual. The 12
Right.
hours per session can be increased to 14 hours per week, depending on the requirement and the bodily mass. So,
Right, doctor.
on an average, 12 hours to 14 hours per week is a good dialysis. This can
Okay.
be divided as 3 or 4 sessions per week.
Right, doctor. So by understanding the way you explained how this dialysis works, the process of how dialysis works, I assume as a layman that there are a lot of ways during this dialysis process a patient may get attracted to any infections. So do you suggest transplantation versus the dialysis, Dr. Karthik?
Okay. Dialysis usually is done through, as I said, there are permanent accesses, temporary accesses when the patient enters into a dialysis phase. The temporary accesses are like catheters. Catheters are some foreign plastic objects that are inserted into our body, and the blood will be carried out, blood will be taken out and returned back to the body through the dialysis. Always having these type of catheters on a long term, like 6 months or 1 year, will attract infection and we are prone to more infection. And having a fistula and being on dialysis is much more better when the patient agrees to continue dialysis throughout his life. So
Okay.
catheters are attractable things for infection. Infection can turn out to be a life-threatening one also. Now,
Right.
taking the transplant, transplant is not just by keeping the organ and finishing off the transplant and asking him to go home. There is a
Okay.
point that he has to be on medications for his life. So
Oh,
these medicines are in layman's term called the immunosuppressants or the medicines that will suppress the immunity totally. So in
okay.
order to keep the kidney working. So there are
Okay.
certain criteria for the person who has undergone a transplant to maintain post-transplant in order to keep his kidney working healthily, like wearing a mask whenever he goes into a crowd, being healthy, practicing hygienic things, using a toilet. Cleanliness is most important thing to prevent from getting an infection. Even though he gets an infection, the infection, if it is identified at the first place and treated immediately, will not cause any life-threatening complications.
Right, doctor. So, for a patient who actually was told by the doctors that you are in a stage of a kidney failure, does it physically hurt anywhere in the body, or like the pain at the back or something?
Yeah, see, there are two types. One, kidney failure occurring due to chronic disease like diabetes, hypertension, or some other things. Second thing is a kidney failure occurring due to stone obstruction, a long term, as I told you before, a stone
Yes.
obstruction or a cystic kidney disease.
Yes.
Kidney disease occurring due to hypertension or some chronic diseases will not cause any hurt to the body, but they
Okay.
will start developing the symptoms stage wise. When the kidney failure progresses, slowly they will develop dryness of the skin color changing, dryness of the scalp, vomiting, decreased appetite, swelling of the feet, some the respiratory distress, tiredness, anemia, and some these are the common symptoms that they will encounter as the stage progresses. Unlike the cystic disease, where the kidney will be replaced by cysts, those if they get infected or if they are enlarging, they will cause some pain in the back, as you said. That will also give symptoms like passing urine in the blood, sorry, passing blood in the urine. And stone
Yes.
obstruction sometimes causes loin pain, but not a permanent basis, but sometimes it causes pain, discomfort.
Right. Thank you so much, Doctor. But I think what we all understood, the bottom line, I believe our ladies and gentlemen, our audience also will agree with me that prevention is always better than cure. So give us, straight pointers to ensure that we maintain our kidneys on a a healthy basis, and to regularly get checked. What type of tests that we can get checked, and we will summarize today's meeting, doctor.
Okay. See, basically, any individual who wants to check his kidneys should approach a doctor and tell them that his kidneys has to be tested. The
Okay.
common markers to do a kidney test is urea, creatinine, an ultrasound abdomen, along with the urine analysis and the urine microalbumin. These are the common tests concerned with the kidney, focusing on the kidney alone to be done. Once these tests are done, it will tell us definitely whether the kidneys are performing well or there is a small glitch or somewhere. And based on this, they can regularly keep in touch with the doctor and keep on checking the progress of any issues that is happening. But I would advise any individual who is crossing 30 years, depending on the lifestyle that we are following now, to undergo a full checkup every year, following the 30 to 35 years once in 2 years, and 35 to 40 years once in a year, and above 40 years once in 6 months or so, depending on whatever the issues they are having.
Sure, doctor. What is that we need to follow in terms of either drinking water or maintaining a proper diet to ensure that we don't intentionally damage our kidneys, or consciously or unconsciously, doctor?
Yeah. Drink a lot of water. Not like you have to drink 10 liters of water per day.
Okay.
No. 2.5 liters of healthy water drinking is very good. Keep
Okay.
yourself hydrated all through the day. Sleep is most important. 6 to 8 hours of sleep is very important. Once in a while, check the blood sugars and blood pressure to make sure they are okay. Because blood sugars and hypertension, we don't know when they come and what damage they have already done by the time we know that. So whenever
Okay.
you get time, go to a nearby clinic, go to a nearby pharmacy to get yourself with a finger prick test of the sugars, and just tie a cuff around your arms to know the blood pressure of yourself. And leading a healthy lifestyle, like avoiding drinks, avoiding smoking, avoiding drugs, is a very good thing. We have to be stress free. Taking a lot of vegetables, fruits in our diet is most important. Cutting down on the excess salt consumption is also very good to keep ourselves away from hypertension. Salt gives us diseases and taste, rather than
Right.
we can just take a little bit of salt and finish up the diet. Weight gain is also another important thing. Obesity and overweight is also a problem. So if you're on that part, do regular exercise, try to bring down the weight, and lead a healthy lifestyle and stay fit.
Thank you so much, Dr. Karthik. I think you have shared one very important and insights about kidney failure and what should we do, what should we not do. We discussed about transplantation. We discussed about the costs associated with it, and we discussed about how does this dialysis function, the process of dialysis, infections, and a lot of stuff which I'm sure we publicly, it's very less available, Dr. Karthik. Thank you so much for spending your time with us. We really appreciate your knowledge as well as the work that you have been doing in consulting with various patients and ensuring that their well-being is maintained. And we are very glad to have you on our platform as well. Ladies and gentlemen, if you would like to consult with Dr. Karthik, he is available on www.medicasapp.com. You can also download our Medicas mobile application on Play Store or App Store if you're using an iPhone, and you can find Dr. Karthik there. Get in touch with him for a preliminary what do you call consultation to understand where you stand. Nothing wrong. It is always important to get checked with the doctors once in a while. And we have tests available on our website itself, like the urea tests, the creatinine tests, the USG abdomen, etc. You can get them at a discounted price, and we can have these delivered to your houses for the sample collection as well as the reports delivery. Once again, ladies and gentlemen, thank you so much for your time. Until next time, we will reconnect one more time with another subject. My name is Varun, signing off from Medicas. Thank you so much, Doctor. Namaste.
Thank you.